for this opportunity. Now, we have been listening to your ophthalmology for the last 2 hours. So I'll start with a photo to test your general knowledge. In this photo, you can see late Pranab Mukherjee, who passed away just 1 week back. You will see him holding a briefcase. This photo was taken when he was a finance minister in 2010. What do you think this briefcase contains? Is it money? No. This is the finance minister with the budget documents, which will be trying to improve our nation's economy. Now I'll show you another photo. You are seeing an ophthalmologist with another briefcase. Does it contain money? No. It contains, it's what's called a trial set or a box. It's also known as trial box or a trial case, which is used to try to improve the patient's vision. Now suppose you open this box. What will you see? You will see numerous trial lenses, both concave and convex. You will see prisms, and you will see some accessories, which are the trial frame. You will see other accessories, which I'll cover in the next few slides. So let's now go to each one. We'll talk about lens. Before I talk, any trial lens can be of two types. One is reduced aperture lenses, where the diameter of the lens part is around 20 millimeters, and it is mounted in a metal or plastic rim, making the total diameter 38 millimeters. Now, there's another type of trial lens, which is called a full aperture lens. Here, the whole diameter of the lens is 38 millimeters, and the rim is very thin. This is the type of trial lens which was seen in the old trial sets, but the present trial sets, most of them have reduced aperture lenses. The full aperture lenses are slightly heavy, but they will allow you, the whole lens to be used for refraction. Here, the central part contains a lens, and there's a rim which obscures the peripheral part of the field. But still, this is what is usually used in most of our trial sets. Now, each spherical lens has got the power which is same in all meridians. And there are around 32 pairs of spherical lenses in each trial set. Each spherical lens will have a handle for the doctor to hold and place inside a trial frame. You have got plus lenses, which are known as convex lenses because they converge light. And we have got minus lenses, which are called concave lenses because they diverge light. And the power ranges from plus or minus 0.12 diopters to plus or minus 20 diopters. Now, the variation is actually graded from 0.25 to 4 diopters. The increments in the trial lenses are 0.25 diopters, while from 4 to 6, it is the increment of 0.5 diopters. From 6 to 14, increment of 1 diopter, and from 14 to 20, the increments is of 2 diopters. That is, in high powers, you get increments like 14, 16, 18, 20. While for lower powers, you can get 4.5, 5, 5.5, etc. Okay. Now, where are the lenses placed? If you open the trial set, the lenses which you see here in the left side, I have marked with a red circle, are the concave lenses. And these lenses have either a red color or a golden color rim. These lenses, because they are concave lenses, they are thinner in the center and they are thicker in the periphery. And when you look through it, the images which you see through look smaller and further away. And these are lenses which are used for myopia correction. Okay. Now, if you look at the right side of your trial set, you will see another set of lenses which have a silver or black rim. They are thicker in the center and the images look larger and closer. And these lenses are the ones which are used for treating hypermetropia. Okay, so these are the two main types of spherical lenses which are present inside a trial set. Now coming to the next type of lenses, these are known as cylindrical lenses, and these are the lenses which are present in the central part of the trial set, which I have circled with a red circle. 90 degrees or at 180 degrees or some specific axis. It is not, the power is not seen in all meridians. This is the difference between a cylindrical lens and a spherical lens. And the axis where the power lies in is marked on the rim of the lens. You can see there's a line here. There's the line which is there on the rim of the lens will help you to know which is the axis in which the power acts. There are 19 pairs of cylindrical lenses, both plus and minus, and their power ranges from plus or minus 0.25 diopters to plus or minus 6 diopters. So up to 6 diopters is only present in a trial set. And the variation from 0.25 to 3.5 diopters, the increment is 0.25 diopters, while from 3.5 to 6 diopters, the increment in the different lenses is 0.5 diopters. Okay, so you will get 3.5, 4, 4.5, etc. While here you get shorter increments, 0.25, 0.5, 0.75, etc. And these lenses are the ones used to correct astigmatism. From the examination point of view, any of these lenses can be put, and you will be asked to identify the lens. You look through the lens and see how the objects are seen. And you can also feel the lens, and you can say whether it's a spherical lens, concave, convex, or whether it's a cylindrical lens. Now let's go to the prisms. Where are the prisms seen in the trial set? The prisms are seen in the left side, but towards the end, okay, towards where it folds up. Okay, this area which is marked with the red circle shows the places where the prisms are placed. What is a prism? A prism is a refractive media where you've got two plane surfaces which are inclined at an angle, okay? And so you will have an apex and a base for any prism. And the power range which is present in the trial set is you have got a 0.5 diopter prism, then you've got 1 to 6 diopters in 1 diopter steps, and 6 to 12 diopters in 2 diopter steps. And what is these prisms used for? It is used to correct and measure the squint or the angle of deviation of the visual axis, okay? Now coming to the accessories. There are numerous accessories which may be seen in the trial set. These accessories are seen in the right-hand corner, okay? So the prisms are seen in the left-hand corner, while in the right-hand corner near the fold is where you get all these accessories. You have got planar lenses, and all these accessories. I'll just give one sentence each in the next few slides. So let's go to the accessories. What is a planar lens? The power of the lens is 0. These lenses help you to test for malingering. See, when your patient comes with defective vision, and when you test, you think that he's malingering or just telling the complaint just to get some sympathy, you will put this lens and then see whether he says his vision has suddenly improved. You know that the power is 0, but the patient doesn't know that the power is 0. And if his vision improves with a 0 power lens, then you have to consider malingering as one of the possible diagnoses in this patient. So this lens is used for that purpose. Now, what is an occluder? Occluder is an opaque one is being tortured. And so the occluder will help you to close one eye while the other eye is being tested. It will also help the eye which is closed, the accommodation becomes relaxed, and you can also dissociate fusion when you put an occluder. Now coming to the pinhole, this is sometimes asked in your viva during the examination. A pinhole is an opaque disc with a small hole in the center, which is roughly 1 millimeter in diameter. This small hole allows only the central light ray to pass through it. And so the peripheral rays of light are cut off, and only the central rays will fall directly onto the retina without any change in its pathway. So it will help you to determine whether the defective vision which the patient has is due to a refractive error or due to some pathological cause like cataract, etc. For example, to explain, see, suppose a patient has got defective vision due to cataract. When you put a pinhole, the vision doesn't improve when the patient looks through a pinhole. But suppose the patient has a refractive error like myopia. When you put a pinhole, when the patient looks through the small hole, the vision should improve. So you are able to differentiate between a refractive error or a pathologic error as a cause of defective vision. And this is also said to be used as a macular function test because the central lateral rays are falling on the macula. As Dr. Sunil mentioned, macula is the most sensitive part of your retina. Now coming to a synoptic slit, here instead of a hole, you get a slit, which is a 1 millimeter width and around 15 millimeters length. It allows only a strip of light to pass through it in one meridian. So it helps us to find out the axis of the cylinder, which is used in the treatment of astigmatism. And it's also used in a test called Finsham's test, which is used to differentiate the halos which are seen in corneal edema and in immature cataract. Okay. Now coming to red and green filters, as Dalia Madam has already mentioned, the red filter is put in front of the right eye, and the green filter is put in front of the left eye, okay? And this is used for color dissociation, and it is used to test binocular vision, to test for suppression, diplopia, and Madam has already mentioned these two tests. At least the word for dot test has already been mentioned by Dahlia Madam. Now coming to the Maddox rod, you see a series of red parallel cylindrical lenses which will convert a point source of light into a line image, and this is also used to test for any horizontal or vertical deviation in squint patients. Now coming to what's called a Jackson's cross cylinder, this will be covered in your afternoon session between 2 to 2:30 or 3:30. You have got a session just on refraction. The Jackson's cross cylinder will be explained in detail out there, but I just tell you the main things.
Please wind up. Please.
Yes, sir. You have got two cylinders which are our same power but at 90 degrees to each other. And then there's a near vision chart where you have got different letters of different sizes and you test whether the near vision is correct or not. And you use it for refraction testing. You can use it in the hospital. You can take it to the camp because it's just like a briefcase. You can do squint evaluation. You can test binocular single vision, and you can do diplopia charting. Now the last part, the trial frame. This is the frame on which you put the different lenses while you test for the vision and rule out refractive errors. You can see there are two circles, and there is a frame with some knobs by which you can adjust the interpupillary distance and also the position of the nose rest. Here you can see the occluder has been put in front of one eye and the lens has been put in front of the other eye. Okay. Now it should be lightweight, non-allergic, and you can adjust the distance between the interpupillary distance and also the nose position. There is a full aperture frame which is used for a full aperture type of lenses. There's a reduced aperture lens which is used for a reduced aperture lens, and you've got a half eye trial frame. Now the last slide. Now if you look at each frame, you will have a main frame which is connected to the ear, etc., which is marked with a red arrow. You can see the red arrow out here. Behind it there is one compartment where you can put lenses. Then just in front of it you have got the second compartment, and that is separated between the green arrow and the red one. The green arrow out here and the red one. And in front of it is marked by the blue arrow is a frame where you can get the axis is marked. You can see the 90 degrees marked here, 180 degrees marked here. And it is in this third compartment that you're going to put the cylindrical lenses. See, the spherical lenses are put in the second compartment, which is just in front of the main frame. And the cylindrical lenses are put just behind this frame where the markings are put. And in front of it, with the yellow color, I have marked another support where you have got the fourth compartment. So you can put all these accessories, high power lenses, etc. in either 4 or 1. 2, the second compartment is definitely used for only spherical lenses, while a third compartment is used for the cylindrical lenses. Thank you for your patient listening, and my best wishes to all the freshers for their academic life and future.